Welcome to Registered Nurses Empire. There are 10 practice questions. You have 10 seconds to answer and check rationalization. Good luck. Question number 1. Which of the following suggestions as negative symptoms of schizophrenia? 1. Avolition. 2. Insomnia. 3. Catatonia. 4. Echopraxia.
3, 2, 1.
The answer is 1. Avolition. Remember, avolition is a sign of a person that lacks the motivation to do an action or to live. Did you got it right, nurse? Question number 2. The nurse is taking a health history on a client when the client states he has been diagnosed with frauderism. Does the nurse know which of the following actions is characteristic of a client with this disorder? 1. Observing others while they disrobe. 2. Rubbing against a non-consenting person. 3. Wearing clothing of the opposite sex. 4. Using rubber sheeting for sexual arousal.
3, 2, 1.
The answer is 2. Rubbing against a non-consenting person. Remember, frauderism is a disorder in which a person derives sexual pleasure or gratification from rubbing, especially the genitals, against another person, usually in a crowd. Keep going, nurse. Question number 3. A nurse is conducting group therapy for patients who are alcoholics. Which of the following statements by nurse needs further teaching? 1. Group therapy should be composed of 8 to 10 members of same problem. 2. Common group therapy in the world is Alcoholics Anonymous. 3. Acceptance of the problem is the goal of this therapy. 4. Group therapy is always being held inside the church.
3, 2, 1.
The answer is 4. Group therapy is always being held inside the church. Remember, group therapy is a form of activity that focuses on awareness of one's mental health. Approximately 8 to 10 members are needed to conduct this activity. Common places where they meet are schools, empty residential lots, churches, and another secluded or private area. Embrace the challenger nurse. Question number 4. The client has been hospitalized for schizophrenia with catatonic features. Which of the following manifestations should the nurse prioritize? 1. Circulation problem. 2. Auditory hallucinations. 3. Delusion of grandeur. 4. Flat effect.
3, 2, 1.
The answer is 1. Circulation problem. Remember, catatonia or waxy flexibility is a positive sign for schizophrenia that makes the patient stay in one position for a longer period. It can cause a circulation problem for being stagnant for more than 1 hour. Question number 5. A client with bipolar disorder states, "You are so handsome today. Can I be your significant other?" What reply by the nurse is most therapeutic? 1. Maybe we can work it out. 2. I am married. I am sorry. 3. I am your nurse. You are my patient. 4. I have to report you to the doctor.
3, 2, 1.
The answer is 3. I am your nurse. You are my patient. Remember, the patient is exhibiting manipulative traits that are why the nurse should set limit by telling the reality to the patient. Question number 6. The client with depression will be now discharged from the psychiatric ward. What should the nurse include in the client's discharge plan? 1. Avoid crowded places during the first week after discharge. 2. Encourage the patient to have a daily exercise routine. 3. Let the patient do his activities of daily living. 4. Stop taking the medications.
3, 2, 1.
The answer is 1. Avoid crowded places during the first week after discharge. Remember, crowded places may cause unexpected injury to clients with depression and may have a chance for the patient to feel overwhelmed in terms of adjusting to the new setting. Question number 7. The nurse arrives home and finds that his friend's house is on fire. The nurse's friend was saved by the firemen. After a couple of minutes, his friend was still traumatized and scared after the incident. What is the nurse's best action at this moment? 1. Give the victim reassurance that everything will be done. 2. Assess the patient's vital signs and condition. 3. Stay with patient. 4. Remain calm and let the patient verbalizes his feelings.
3, 2, 1.
The answer is 3. Stay with patient. Remember, the patient is suffering from panic anxiety. The best management of this event is to secure the client's safety by staying with the patient. Other managements are using simple instructions and stay calm. Question number 8. Which of the following question is the best way to ask for a patient with suicidal intention? 1. Do you have your last wish? 2. What do you want to do with your life? 3. Can we talk about it first? 4. Are you planning to kill yourself?
3, 2, 1.
The answer is 4. Are you planning to kill yourself? Remember, patient with suicidal thoughts is amenable to divert their way of thinking if the approach of the nurse is pointing out directly the suicide plan of the patient. Question number 9. The nurse is taking care of a client with schizophrenia. During the rounds, the patient verbalizes that, "I should get out of here and save my planet Earth. My people need my superpower." Which of the following signs of schizophrenia does the patient manifest? 1. Illusion. 2. Hallucination. 3. Delusion. 4. Looseness of association.
3, 2, 1.
The answer is 3. Delusion. Remember, delusion is an alteration in thought, the content of a person. It is a fixed false belief. This manifestation is a positive symptom of schizophrenia. Management is to not confront the client's belief. Question number 10. A client who is depressed is suffering from dry skin due to a lack of proper hygiene. Which nursing action is appropriate for this situation? 1. Stressing out the importance of hygiene. 2. Wait for the client's approval and initiative to take a shower. 3. Decide for the client by accompanying him in the shower room. 4. Create a routine shower schedule for the client.
3, 2, 1.
The answer is 3. Decide for the client by accompanying him in the shower room. Remember, client who is depressed cannot do decision-making, even simple decisions. That is why the nurse should make the simple decision for the client regarding daily tasks like eating and bathing. How many score you've got out of 10 questions, nurse? Job well done. See you on our next review. Bye.